Hey, welcome back everybody to another Living Kinetics video. I know it's been a while since we've posted, but we're totally stoked to be back and providing some awesome content. We're going to start off our 2022 debut with commonly overlooked muscles in a massage session. If you're not getting these muscles worked in your massage session, then I encourage you to talk with your massage therapist and see what you can do about incorporating some work with these muscles here, as I feel that they could heavily benefit you and really turn things around. So let's go ahead and get started here. One of my favorite muscles, and I've definitely talked about this one before, is the SCM muscle, right? Sternocleidoid mastoid, SCM. This muscle here, the trigger points in it, the knots in it, can cause a lot of headaches, right? All sorts of different headaches. Like oftentimes when we're talking headaches, we talk mainly about the trapezius muscle here. He gets a lot of credit for that. But I would also encourage not just working the trapezius muscle, but working this SCM muscle as well. Can also contribute to poor posture, right? A lot of forward head type of posture. Like if you spend a lot of time driving or you're on the computer, this can really be a tight muscle. Or maybe you sleep with a really big pillow. Oftentimes massage therapists will work a lot of the back of the neck where that trapezius was at, and we don't address the front of the neck, or as you're going to see with the next set of muscles here, the side of the neck, right? We've got our scalene, the posterior, middle, and anterior. This set of scalenes here also can contribute a lot to neck pain and shoulder pain, and because of the delicate structures that run through, when these get tight, we can pinch down on nerves and on arteries, and that can make us overall weaker. This can be a delicate area to work in, especially if you've never had it done before, but I do encourage you to ask your massage therapist about working this area, because again, it's really easy for us to just work the backside here, this big trapezius muscle, and not address the rest of the neck. Let's go ahead and keep moving on though. We're going to move down the body here to pectoralis minor. Now we've all heard of pec major before, right? This big pec muscle that sits on the chest right here. Chest work is oftentimes overlooked in massage anyways, but when it is done, I find a lot of the time that we don't get into this pec minor muscle right here. And much like the scalenes that we just talked about, you have a lot of delicate structures that are going under it, right? So when this muscle tightens up and it brings the scapula forward to that rounded shoulder position, you can pinch down on a lot of these nerves, and that can cause a lot of dysfunction in the arm. In fact, a lot of the times when people tell me that they have arm and hand pain, I start my work up in the neck and the chest before moving down into the arm, because that a lot of the times is where a lot of the pain is coming from. Now before we move down into the psoas muscle, I wanted to address our subscapularis muscle here, part of the rotator cuff. Now the subscap muscle, as you can see, it's not totally visible or really visible at all from the posterior side, from the back side here, but you do get a little bit of the view from the front side or anterior side. And that's because it is in between your shoulder blade, your scapula, and your rib cage. So it's a very deep muscle, and in fact, how you access it is from the front side right here by actually getting in between the scapula and the rib cage. Now this can be a little on the intense side, but the benefits are awesome. The knots or trigger points in the subscap muscle here can give you posterior and anterior shoulder pain, but what's remarkable about it is it can also skip the entire arm and give you wrist pain. So there are times where you think your wrist is acting up. Maybe you think you've got carpal tunnel syndrome or arthritis or something like that, and it's not so much that you have dysfunction in the wrist, but it could be that you have some dysfunction in the shoulder right here. So I would ask your massage therapist about that if you are experiencing any shoulder or wrist pain. Now let's go ahead and move on to a muscle that I've talked about plenty of times before. Peel back some muscle layers here, and we're going to get into the psoas muscle, psoas major here. And in fact, really all the hip flexors in this the deep hip flexors here, right? So we also get the iliacus muscle, which is somewhat superficial, especially up by this part right here. But our deep hip flexors can contribute a lot to low back pain. And oftentimes when we have low back pain, well, any massage therapist is going to work on the back, and they're trying to get into this quadratus lumborum muscle. Now that's fine, that's awesome, and I do encourage it, and especially if you're going to get into the big hip muscles right here as well. But I don't think that the psoas muscle should be overlooked. Now it can be kind of intense to work on. As you saw, I peeled back a lot of muscle layers to get to it. And of course, you've got your digestive tract sitting on top of it as well. So you kind of have to work through all of that to get down into this muscle. Now, if it doesn't seem like a viable option, or maybe you're not comfortable with somebody working on your abdomen, absolutely there are stretches that can be done that I think can really facilitate the lengthening of this muscle and get this area to relax. What I might say, or what I should say at this point, is a weak muscle can feel like a tight muscle a lot of the times too. There are times where, because of our lifestyle that we live, a lot of us do a lot of sitting throughout the day, whether we're driving or working at a computer, and we might think this muscle is really tight. It can also be really weak as well. So you might want to look into some hip flexor exercises to help strengthen up this muscle. And of course, I encourage exercise just kind of all over the body. The stronger you are, the better off you are. Now, before we move down into the adductors, we had mentioned the hips here. And I find a lot of the time that yes, hip work is done over the glute max muscle here. But what I find is it's incomplete, because you've got 3 different glute muscles, main glute muscles I should say. Because of course you're going to have medius as well. But on the very side of the hip here, you're going to have glute minimus. And he's very lateral. In fact, he is basically the most lateral you can get on your hip right there before it wraps around to the front side. Now this muscle, along with glute medius, is going to help stabilize the hips. It's basically going to help level out the hips. So if you are a person who stands on one leg, as you're just kind of like queuing in line or something like that, and you shift all your weight onto one leg, these muscles are going to try and fire to level that out, right? Or maybe you sit kind of awkwardly in the car as you're driving. These muscles are going to have a hard time leveling out the pelvis for you, and they're going to be chronically tight. And what that's going to do is it is going to cause some low back pain, some hip pain, maybe even some leg pain. But this is just one of those muscles that a lot of massage therapists don't get into as well, right? They do a good job going directly down to the hip and closer to the sacrum here, getting more of that maximus part. But they don't necessarily, it's almost like you got to get parallel to the floor to work this muscle here, or even if you're in a sidelining position, that could help out a lot. But I've noticed just in a lot of the sessions I've gotten, this is heavily overlooked. Moving on from here though, like I had mentioned, we're going to get into the adductors. And up until this point, I've really been talking about kind of individual muscles, for the exception of the scalenes. But much like those, the adductor muscles here are, a bunch of different muscles. But we call them the adductors because they all do the same movement. They adduct the hip, or they bring the knees together. Now, a lot of the times, we do totally fine working the back of the thigh, the hamstrings, or the front of the thigh, the quads, but we oftentimes overlook this medial aspect, or this inner aspect here. And these muscles here can be chronically tight. They can contribute a lot to low back pain because of it. And you're going to find it remarkable when you do get these muscles worked and you see how much different your legs feel. And because your legs are have the ability to more freely move and stabilize, how much better your low back is going to feel because of it. But now let's go ahead and move on from here, and we're going to just keep moving down the body here. So our tibialis anterior muscle, and in fact I'm going to pair this up with another muscle as well. So we've got the front of the lower leg here, tib anterior, tibialis anterior, and I'm going to rotate this back, peel this back a little bit, and we're going to see the soleus muscle as well. Now, really, the lower leg in general, I think, is like overlooked. You know, like we do a really good job on the back, pretty good job on the hips, okay job on the thighs. Most of the time, it's a terrible job on the lower leg, and then the feet. We spend an extra amount of time there, as most massage therapists do. But with the soleus and the tibialis anterior muscle, these muscles are really responsible for stabilizing the ankle over the foot, right? And much like any building, if you have a bad foundation, everything above it isn't going to act properly, right? You're not going to have stability above it. And what you might find is that the tighter these muscles are, the tighter everything else feels in the body. So I would definitely encourage that for you to talk to your massage therapist about these muscles, particularly the soleus muscle. As you just saw there, we've got the big gastrocnemius muscle. And, you know, this is that beautiful heart-shaped muscle on your calf, right? Like, it's very easy to get to this muscle, but it's a very big and powerful muscle. And under it, we've got our soleus muscle. So it's a little difficult for some massage therapists to get into, because you do have to actually go to the medial and lateral sides of the gastrocnemius and kind of work your way under it to get to this muscle right here. But I think it can make a world of difference in just about everybody, because again, there's not enough flexibility in our lives, and if we're only working the muscles that are superficial or that are easy to get to, we're doing an incomplete job. So I hope that you got a lot out of this video. I hope that you talk to your massage therapist about some of these muscles. And again, if there's ever a point where it's maybe too intense to work with directly on with direct pressure, talk to them about stretching the muscle. Especially some PNF stretching can go a long way. Thank you for your attention, everybody. I super appreciate you, and I look forward to seeing you in the next video.